I am an adult nurse practitioner and clinical specialist in oncology from Emory University. I received my Doctor of Nursing Practice from Vanderbilt University. I'm currently developing the oncology program for the state of Michigan prison system, which is a huge undertaking. I have practiced in multiple specialties throughout my career that have included orthopedics and spine and other entities. I've been appointed to multiple state and federal initiatives on advanced disease and palliative care. I am the founder and director of the Multiple Chronic Conditions Resource Center, which is highlighted by the U.S. Department of Health and Human Services as a premier resource for interprofessional healthcare providers. As a member of the editorial review for the American Journal of Nursing, I was asked to author a viewpoint, which is like an editorial on practice issues, and I wrote The Nurse's Role in Medication Safety, which kicked off a series of papers that I have authored on several specific medication topics. I believe that nurses are responsible for their practice, and the medication errors that are pointed out in this article have led to unnecessary mortality for several patients. So for nurses to gain a better understanding of drug classes, drug-drug interactions, and familiarity with generic medication names is important. As I said, it's important for nurses to be responsible for their clinical practice patterns, and part of that is to be educated on the specifics of medications. Last year in the news, there was a lot on the news about nursing and the wrong medication, the wrong dose, and several patients lost their lives as a result. So bringing attention to the importance of, as I mentioned earlier, fully understanding a specific medication, the dose, the indication, and an indication is what the FDA has approved it for. If somebody's using that medication other than what it's approved for, that's considered off-label and obviously increases your risks. But the other thing, as a member of the editorial board for the American Journal of Nursing, I recognized that this was an opportunity to launch a series of other papers to include the recent publication on opiates in the management of non-cancer pain that was recently published in AJN this month, actually, February. I also have a paper that's coming up on benzodiazepines and anticholinergics, and have been thinking about writing a paper on the FDA black box warning and what that means for nurses. So having an understanding of the important classes of medications that are often associated with considerable morbidity and mortality was the purpose for this editorial, and the reason other papers are following as a result of that. Well, nurses really can't afford to practice in the dark. We should never make assumptions about medications. If we don't really know what we're doing, we should always look it up. The drug, the dose, as I said before, the FDA-approved indication. We have smartphones. Hippocrates is a great place to look. So not just relying on the provider to write the orders and assuming that that provider knows what they're writing, but slowing down, relying on the clinical guidelines. The Multiple Chronic Conditions Resource Center provides all the guidelines, current guidelines on the management of chronic disease and symptoms. It's a free resource. And to promote safe practices that protect the patient, the family, and the nurse, and our profession.